Hi everybody and welcome to Different Leaf, a show for new and experienced cannabis consumers. I'm Brit Smith. This episode, we're going to get into the controversial but incredibly important topic of medical marijuana for children. Now, when you Google how marijuana impacts kids, the first results usually relay something sort of scary about how cannabinoids may negatively impact developing brains. And that understandably puts a lot of parents off the idea of exploring CBD and even THC as a first line of medical treatment. But we've now got several FDA-approved pharmaceutical medications in the US that are essentially lab-created mimics of the CBD molecule from cannabis, like Epidiolex, which was developed specifically to treat rare types of pediatric epilepsy. Those medications came about because scientists became interested in the anecdotal reporting from parents who were at a loss for what to do to help their children through terrible seizure disorders. And those parents found that the non-intoxicating extract of CBD was the only medicine that helped their child survive, to stop seizing 100 times a day, and even to start moving and speaking again. You've probably heard of Charlotte Figi, the young girl who inspired the medical CBD movement in the US, after her parents successfully treated her rare epilepsy disorder with CBD oil, giving hope to other parents who were on the brink of losing their kids. Medical experts soon started studying the potentials of medical cannabis for people under the age of 18 at leading global institutions like the University of California, Hanover Medical School in Germany, Tel Aviv University, and Peninsula Medical School in the UK. Thanks to Charlotte Figi and her family, we are now in an age where CBD is widely accepted as a safe and effective medicine for many ailments. It's now legal across the states, and many parents and guardians are toying with the idea of administering it to their kiddos to help with an even wider range of issues, like autism, anxiety, and depression. So what does the scientific research say about how both CBD and THC might impact kids with otherwise difficult to treat issues like epileptic seizures, PANDAS syndrome, which involves the sudden onset of OCD and tics following a strep infection, Autism Spectrum Disorder, neuropathic pain, and even severe anxiety? Our guest today is Sasha Kalcheff-Korn, Executive Director of the Realm of Caring, a non-profit organization founded by two moms, including Charlotte Figi's mom, which advises and helps guide anyone interested in learning more about the medical uses of cannabis for both children and adults. Realm of Caring collects and analyzes scientific research from around the world and helps educate parents on whether medical marijuana might be able to help better the lives of their loved ones, no matter their age. This episode will be talking about what the research says about CBD and THC's place in pediatric care, what the Realm of Caring usually advises for parents who are curious about the potentials of medical marijuana, what to do if a child overconsumes by accident, and what the most reported uses have been of successful pediatric medical cannabis applications over the last decade. You can also read up on pediatric cannabis research on page 36 in the latest issue of Different Leaf, the magazine. It's called Growing Hope, Developing Trends in the Use of Cannabis in Pediatric Care, and it's by our writer, Jackie Bryant. It's part of our winter issue, which focuses on medical marijuana, and it's out now on shelves across the US and Canada. Go to differentleaf.com to find your nearest retailer or to order yourself a copy to be mailed to you. That's differentleaf.com, and we'll be right back to chat with Sasha Kalcheff-Korn of the Realm of Caring. Well, it's a pleasure to meet you. Thank you so much for being here. So let's start off by talking about what is Realm of Caring? What do you guys do?
Sure. So Realm of Caring is a research, education, and advocacy-based nonprofit. We are about to be in our 10th year. So we started in 2013 as a formal organization. And just to kind of go a little bit into the history of what we do, because I think it's just all relevant how it adds up to where we are right now, is we started with two mothers who simply were looking to save the lives of their children. They met while their children were in hospice, suffering from different epileptic conditions. One was Doza syndrome and one was Dravet syndrome. And they both found separately that there was an answer in cannabis. And so one mother explored that, and she's Paige Figi, and her daughter is Charlotte Figi, who is the namesake for Charlotte's Web CBD oil. And the other is Heather Jackson. Zakai is her son, and he is now 19 years old. And so here we are 10 years later. So they found that this cannabis could be a solution, and it could actually save their lives, not just eliminate seizures. And so once they got that message out and it got to these different groups that they were a part of, people started leaning on them and saying, okay, well, what worked for you? And how can we get some? Because this is pre-farm bill in the States. And so CBD wasn't legal federally yet. And so they started helping people move out to Colorado as medical refugees, sometimes in the middle of the night, because there was the fear of Child Protective Services knocking on their door the next day. And so they would help people literally move in the middle of the night. And so they started moving people out here. And then they thought, well, let's just make this information more widely available. And so they opened a free call center. And so now it's our hotline that's still active today. We've helped over 72,000 clients worldwide on this hotline, just calling in for free support. And just based on anecdotal data that we've gathered over time, we just help them with what is cannabinoid therapy? How can I get started? What's a dose? Just holding their hand through that overwhelming process. And then these women thought, well, we can't stop there. Let's actually legitimize this research, and let's partner with Johns Hopkins, one of the best. So they partnered with Johns Hopkins University. We opened our observational research registry, which has now since grown to the largest observational research registry for cannabis in the States. And so some say the world, so we might be in the running for that as well. So now that's what we do today. We collect the research. From that research, we have just published our 4th paper. We still help our clients on the phone, and we use this research to help legitimize the therapy, both informally, so that society, right, we're like eradicating that stigma. It's a safe space for people who choose to use cannabinoid therapy, but also formally through policy change, helping to pass legislation state to state. So using it for advocacy needs as well.
That is an incredible organization with an incredible backstory. Wow. Let me ask you, what the 72,000 people that have called you for advice, what are most of them looking to learn about? Is it mostly to learn about how medicine can help in pediatrics?
A lot of it is, yes. So we started mostly with pediatrics. Since then, it's sort of flipped. We have a lot more adults. So our population now is more so month to month, about 74% adult, and then the rest pediatric. But we still have, it's a lot of caregivers. So whether that be for a mother, a sister, a daughter, someone's calling for help because they're a caregiver and they just want to know more and they think that this could be the answer. So it's a lot of, how do I get started? I've tried everything and everything has failed. And what does a dose look like? I don't even know where to begin. And that's probably the biggest one, because you get a bottle of CBD or you get whatever your cannabis product is, and there's no instruction manual because it's not a one-size-fits-all approach. Just like It's like with vitamin C, you can get a suggestion, but it's not going to be catered to you and what you are going through.
So where do you get the kind of research that you base your answers on? What do we know right now that you can tell parents who want to know about how cannabis or CBD oil could help their kid?
Yeah, great question. A lot of it comes down to just the research that started mostly in Israel and has expanded since then, but understanding really the mechanism of action of these cannabinoids in our body. And so if we understand that, CBD for one is a modulator. So when it comes to something like depression, it's not going to have an effect in that it increases the amount of serotonin your body creates, like an antidepressant might do, but it might help your body to utilize that serotonin it creates just more efficiently so that it can have the antidepressive effects. And so once you understand these different mechanisms of action, even if it's not for maybe a very specific ailment, like a lot of parents are calling recently for PANDAS or autism, which are pretty difficult to help with dosing because it can be so different from case to case. But once you understand that, you can help sort of navigate that path and navigate a starting dose and then how to increase from there. And we really just hold their hands throughout the whole process. We'll call you back and bug you in 3 weeks if you don't call us, because we want you to find success. That's what matters. And if it's not this product, we'll find a different product. And we'll just continue that path with you so you're not alone.
Wow. I mean, there must be so many parents out there that want to know where to start but have no idea who to ask about. And as a mother yourself, let me ask you what you do when people ask about sort of the stigma of treating a child with cannabinoid therapeutics. What would be your advice to parents that are considering this as a line of medicine but are really worried that either like their family and friends or maybe the medical professionals in their child's life aren't going to be on board with it?
Of course. And that is always a great question because it's one that we get often. And it's, I guess a lot of the times for myself, it's almost like, well, look at what the alternative is and look at the side effects of these certain pharmaceuticals that could leave your child catatonic or cause seizures or delay growth or make who was once a verbal child nonverbal. And so it's, ultimately it's up to the parent and their gut feeling when we're talking to them. Your mom, you know best is what we always want to say. But when it comes to eradicating the stigma, there are pharmaceuticals out there that are proven to have way worse side effects than cannabis might ever have on a child or the development or so, it's like, what state would you prefer? And then also we always guide with a path of least resistance, like a CBD. We know it's a safe molecule. It's non-euphoric because there's very little THC. And so we want to ease into it very comfortably with them because you're right. As a mother myself, when it comes to your children, you just want to do right by them, whatever that might be. Yeah. But then for eradicating the stigma for these parents, it's just, you know best, so do what you think. We are going to work on the society for you. We're going to work on the research so we can sway their opinions the other way. But do right now what you feel is best for your kiddo.
What a difficult decision to have to make, especially when, I guess, when this all began back in sort of 2012, 2013. We weren't at the place that we're at right now with medical marijuana or recreational marijuana. And there was a lot more pushback against the idea that children could benefit from the kind of medicine that can be found in cannabis plants. Mm-hmm. So let's talk about what we do know now. We're about 10 years on. And all this time after Charlotte Figi was successfully treated with CBD oil that really took her seizures down to none a day, incredibly. And so we have seen medicines that have come from that have been taken from the CBD molecule and produced into pharmaceutical medications like dronabinol, Marinol, Epidiolex, and those help with very specific kinds of epileptic seizures. You mentioned Dravet syndrome. What else is it that we can say for sure that we know right now where the research is at that we feel comfortable by saying CBD definitely can benefit children for this issue or this ailment? What is there that we know right now?
Of course. Well, so we're always careful to say, it might help, it may help, right? We never want to use definitives, even though we know that the research is there. We also know it's case by case, and also your success rate depends on consistency, other things you might be doing putting in your body. And so we just always want to preface whenever we're talking to somebody that it could be a lifestyle change. It might not just be this one miracle plant that helps you. But we do know from our own research alone, anxiety, depression, different neurological disorders, epilepsy, so seizures, and then overall quality of life can help to improve sleep. And so one thing that our epilepsy study showed is pretty remarkable because it looked at the scale of not just seizures or epileptic activity, but it looked at decreased ER visits or doctor visits or less school days missed or better sleep patterns. And then it also looked at the caregiver burden score. So the parent taking care of their kiddo, that increased remarkably. And that's the piece that I love to share with people because it's not just an effect on the child, but it's the whole family. It's the whole unit that is helping this child through what they're going through. And we have all this research that we're continually accumulating. And a lot of it is observational, which is where that it's tricky because when it comes to things like Epidiolex, they want to look to the clinical data. But what we are doing is looking at how people are using in their everyday life. We're marking it down and we're reporting on that. And so that's where also I feel that we need to pay more attention to observational research and look at the importance, because how these individuals are using it in this research is how you and I would use it, because we're not all going to be in a clinical study, right?
Yeah, it's kind of like looking for the markers of wellness, like you're deciding sort of what makes for a healthful life for you. And when it comes to CBD, there seem to be very few side effects that can be considered negative. When it comes to THC, we're talking about something kind of different. And this is one stance that I was surprised to see the realm of caring taking on THC, that there is actually a place for it in pediatric care. Can you tell me sort of what parents should know about the dangers, the benefits, the potentials?
Of course. So we always recommend starting very low and going slow, especially when it comes to a molecule like THC, because there's a lot of benefit that could come from just microdosing. And it, depending on the case, it doesn't have to be a forever, like every day. You might be taking CBD twice a day, every day, but THC might be helpful to introduce when you need help with specific things, like if it is sleep or it does calm anxiety, or in worst case scenarios where there is a tumor growth involved and it has that anti-angiogenic effects. So we just want to approach it cautiously, never pushing a parent to do more than they're comfortable with, but then also recognizing things, the little warning signs that are out there. So there was a big to-do about cannabis causing psychosis. And so there is no research to show that, but there is a research to show there may be a correlation for those who are predisposed to a mental illness and those who use THC. So whether or not that THC maybe encourages that mental illness to show up sooner than it may have had it on its own, that's still up to debate, but that might be that correlation. So it's also that, it's just understanding, what's in the genetic profile of the child. So you just want to approach it cautiously and take it slow, just like you might do with any medication. But there are parents out there too who want to say, okay, more is better, but that's not always the case with cannabis. It's less is more.
Yeah, absolutely. Right, definitely. And when it comes to young developing brains, they're still growing. There's a lot of plasticity going on there. It would worry me as a parent to consider giving them something like THC, which would be psychoactive, even if just slightly. Is there some basis to that? Should parents be worried about those sorts of side effects, or are there ways to minimize those and they're more beneficial than they are harmful?
Of course. Well, I would say that it does interact with our CB1 receptors, and the CB1 receptors on our brainstem, which would trigger dependency. The THC doesn't interact with those receptors in the way that like benzodiazepines might do. So there's not a ton of known risk involved with the THC. And if there was a euphoric activity that happened, it is typically something that would be short-lived or that wears off. And there are things you could do if you had a fear that your child had overconsumed by accident. And so, we'll always follow the safety protocols of, if you feel that your child got into maybe your medicine, mom or dad, then you want to maybe call poison control, or just make sure they're not too lethargic or too off balance. You just look for those signs. I think there are things to look for, but when like I said, in comparison to certain pharmaceuticals that could actually possibly change the wiring of how that child is developing. I mean, Charlotte Figi is one example where she was a growing verbal child, and then one pharmaceutical made her completely nonverbal. And Heather's son, Zakai, went through and failed 17 different pharmaceuticals before he was on hospice. And so it's the give and the take, and what do you want to look to? But then also, I would just say, when it comes to THC, before just going into it, reach out to someone like Realm of Caring who could say, maybe it's not even necessary. Let's just start with this other cannabinoid first, and then look to THC if and when XYZ.
So let's talk a little more about the Charlotte's Web story. A couple of years ago, the Realm of Caring was involved in giving away a lot of this Charlotte's Web oil, which is CBD heavy, really, really rich, really, really good stuff. Can you tell us a bit about sort of what kind of patients benefited from that giveaway? Who received it? What were the issues that they were treating with it? And you mentioned that some of them were adults, some of them were children. If they were children, do you happen to know what was being treated?
Yes, actually, we did document that because we took intake for all of the requests because Charlotte's Web, the company, was so kind to give this great donation after Charlotte's passing in 2020. So when she passed away, it just shook this whole industry. And it's like globally, we were mourning her loss. And we thought collectively, what is the best way to honor her? It's how can we help to heal more people, especially during this time of isolation and depression and anxiety. And the pandemic has really just kicked off a few months prior. And so how can we show that we're together while we're separated? And so they donated $1 million worth of product. And so we put it out to all of our community and all of our social channels, and the response was incredible. And we were curious about conditions because we just wanted to know, and how people reported. It was a lot of reflection on the pandemic. So it was for adults, it was a lot of anxiety, depression, sleep issues, chronic pain that creeped up because it's all cyclical. You're not sleeping, the pain's going to come, the depression's going to come, right? It all revolves around. And so we saw a lot of those diagnoses or ailments that were very specific to the time period. And then for the kiddos, a lot of epilepsy, a lot of autism. It's one of our fastest growing, I would say, populations of clientele is autism spectrum disorder within kiddos.
I want to ask a little more about the ASD. I don't know if Realm of Caring does research or if you guys analyze other research, but what's going on right now in that space? What do we know about what cannabis or CBD could do for autism?
Right. So they actually have shown in some research that some who are diagnosed with ASD have an AEA deficiency. So one of our endocannabinoids we might be deficient of if we have that diagnosis. And so there have been certain cannabis doctors who have related a cannabinoid deficiency, an endocannabinoid deficiency, to like a vitamin D deficiency or vitamin C deficiency, because it might be key nutrients that our body is missing out on. And so if we know that there is a deficiency of endocannabinoids, then there's the potential that cannabinoid therapy could make up for those lost levels. And what they found through a lot of research is that there's actually pro-social behaviors in those who are diagnosed with autism or, decreased mood swings. I've personally had clients where they mentioned that their daughter, and she was on the spectrum, and they were sitting at the kitchen table, and when she was done eating, she verbalized that she was done eating. And the fact that she could connect that, like, I'm finished eating, I'm going to say I'm done so I can get up and be excused, was something that she hadn't done before. And that's when the parents, because the cues can be really small with cannabinoid therapy, but that's when they saw and they said, oh gosh, oh wow, this is actually working for her. And so for us too, research is limited for what we have to show, but that is one of our goals, is to continue to recruit so that way we can show the efficacy, we can legitimize for this population, but then also we can understand, is it high CBD? Is it a little bit of THC? What's the ratio of cannabinoids that is helping out these kiddos? Because us personally, we find that it is one of the most difficult diagnoses to pinpoint a dose down. It's a lot of up and down. Yeah.
I bet it is, because when you think about autism, it's called the spectrum disorder because there's just so many variations of it. And you think about cannabis, it's kind of like there's so many strains, there's so many variations of the plant. I wonder when we'll get to the point where we have the sort of research where we can say, if you have these symptoms, these terpenes and cannabinoids and flavonoids will help. And we can really piece those parts together and be really specific about it. My brother was on the autism spectrum, and as kids, he was very, very agitated very easily. He couldn't quite get his emotions and his words under control. But as soon as you put the boy in front of a piano or some sort of instrument, like, he was so happy. And I think that throughout his life, he's found a lot of different natural ways to sort of treat his anxiety and his stress and the kinds of things that come with communication issues for some people on the autism spectrum. But he actually found THC to be really agitating and CBD to be really helpful. So I feel like, you know, the more I can research and study and the more I can tell him, like, maybe try CBG or maybe try CBV, you know, we can start to get a little more specific and guide folks away from the kinds of cannabis that don't benefit them and towards the kinds that do. Because I didn't want him to get afraid from the THC that this was not a plant that could help him. I wanted to let him know that, you know, it still is quite possible, but we have to find the right dose, the right cannabinoids, and that's really a fine science. So I guess you guys have a lot of research that you keep up with.
Yes, yeah, absolutely. And you're absolutely right, because when you mention that you don't want him to be afraid, that's also something we don't want. We want to ease into it. We want to hold your hand so we can navigate it with you. But there's so much research that comes out every day. And so our care team is diligent on keeping up with that, so that way we can make sure that we're offering the most up-to-date and best advice as one is going through this.
That's great. I'm so glad that there's an organization out there that I can rely on and turn to for support. I'm trying to start my own little family at the moment. And, you know, when I have kiddos, I want to be really well versed in what's going to be the healthiest for them. And no parent ever wants to put their child through pain or turmoil. We all want to take care of the kiddos in our life. So I will definitely be keeping up with the research that you guys do. And I appreciate you so much. Before I let you go, where can people learn more about what the Realm of Caring does?
Our website is realmofcaring.org. You can also contact our free hotline, our care team, at any time. Our email is info@realmofcaring.org, and you can go to our website to schedule an appointment, so that way we can hit everybody that are on different coasts, because we are global. And then all of our social media handles are at Realm of Caring.
Awesome. Thank you so much, Sasha.
Yes, thank you.
A big thanks to our guest today, Sasha Kalcheff-Korn of the Realm of Caring. Next week, we'll be learning about how we can make our own at-home infusions with Massachusetts Cannabis Advisory Board member and the CEO of the leading device companies Arden and Billow, Chanel Lindsay.
So just taking the material and making sure that your material that you're infusing is fully covered by whatever medium, right? So you want to make sure that you're putting the oil or other fat. You can also infuse into alcohol too. What you want to do is make sure that you're using a high fat or a high alcohol medium in order to infuse. Things like that are water-based are not going to be good to infuse.
Be sure to like and subscribe to the show wherever you're listening right now, and follow us on social media at Different Leaf, and I'm on social media at Brit the British. Check out differentleaf.com for all the issues of our gorgeous medical marijuana magazine, which is now on the shelves at thousands of locations across the US and Canada. And head on over to xdifferentleaf.com to get signed up for our super cool new merch line. That's differentleaf.com and xdifferentleaf.com.